my name's Dr Craig Mallorie. I'm here today to talk to you about wisdom teeth. Now, wisdom teeth can cause all manner of issues. Classically, they erupt between the ages of 18 and 25, and they can be impacted. Now, impacted is when there's not enough room for the tooth to come through, and it either impacts against the gum or bone behind the tooth or against the tooth in front. This can create an area that's nigh impossible to clean, and food and bacteria can stagnate, and initially they can cause a bad smell, a bad odour or bad taste as the food and plaque is building up, and then long term they can cause decay either in the wisdom tooth or the tooth in front. So once we start noticing there are issues, patients present with pain and swelling, which is called pericoronitis. This can be grounds to really start investigating removing the wisdom teeth. We send patients for a two-dimensional X-ray called an OPG, which allows us to look at the root anatomy, and there's also a nerve that lies within the bone called the inferior alveolar nerve. We want to see how the roots relate to that nerve. If they're in intimate contact, then sometimes we send the patients for an additional X-ray, which is a three-dimensional cone beam CT, which is 30 times lower radiation dose than a conventional CT scan, and it allows us to very accurately assess the path of the nerve with relation to the roots. Sometimes it look like it's close on a two-dimensional X-ray, but on a three-dimensional X-ray it's very far from the nerve and very safe to remove. If the roots are in intimate contact with the nerve, then we may consider doing a procedure called a coronotomy. And a coronotomy involves removing the top 2/3 of the tooth and leaving the lower third in situ. And it's part of you, it's part of your body. The bone heals up around it as normal. We've removed the stimulus at the top, the problem with the food packing, and the gum heals over the top as if the tooth had been removed entirely. And that is a very safe way of managing and reducing the risk of you having nerve damage after the procedure. Classically, with lower wisdom teeth, there's a risk of about 0.1% of causing a permanent or a temporary numbness of the lip, the chin, the teeth and the tongue. This is a risk on average across very complicated wisdom teeth removal and much more straightforward wisdom teeth removal. So we can give you a much more